Hi, everyone. Welcome back to the Doc Talk podcast. I'm Dr. Sheila Wijayasinghe.
And I'm Dr. Shazma Mathani.
How's your week been, Shaz?
Very busy. My kids, as I think a lot of people know, are ski racers. And so it's just like at the tail end of winter, there's like a bunch of ski races. So we've been away every weekend, just like lugging all the gear and doing all the things. But you know, the kids love it. So it's great. How about you? How's your week been?
That's so fun. My kids are not coordinated enough to do anything like that, but they're 5 and 7, so we're waiting for it. Pretty good. I got back from holiday, and classically, we all got sick as we got home. So, dealing with that, but hoping we're close to the spring. We're almost there. I'm really excited about today's topic. And I kind of has given me a little bit of light, even though it's a hard topic to talk about for many people because it affects so many. But an important one. But so important. So, today we're diving into a topic that affects millions of people, which is bladder health. And specifically, we're going to break down things like UTIs, kidney infections, and sepsis or urosepsis when things get even more serious, which is really what you see a lot more than I do, Shaz, in the Emerge. We're also going to talk a little bit about an under-discussed topic of incontinence and why it happens, how it impacts people, and what you can do about it.
Yeah. And like you mentioned, Sheila, this is such an important topic for you as a family doctor, but for me as an Emerge doctor as well. So I see a lot of people come in with urinary tract infections. I then also see people who come in who are sicker with, things like a kidney infection or even worse, sepsis. When we're on the milder end in terms of things like a UTI, simple antibiotics can fix it as long as they're treated early if the symptoms are getting worse. But if they are left untreated or there are any other underlying issues, then things can become more severe. And then, of course, when it comes to incontinence, that's something we absolutely don't talk enough about. We know that millions of Canadians are affected by incontinence, both physically and socially. And I think that it's really important that we start talking about it more to normalize the conversations and kind of encourage people to get managed and get help.
For sure. It's one that really carries a lot of shame for people, right? So they sort of suffer through it instead of getting that help that is available. So first, before we start off, just like we do with our other episodes, we want to hear from one of our listeners.
Hi, docs. My name's Rachel, and I keep getting UTIs, like multiple times a year. I drink water, I pee after sex, but they keep coming back. What am I missing? And when should I worry that it's more than just a UTI?
So Rachel, you are not alone. UTIs are one of the most common bacterial infections that we see, especially in women. And about 60% of us will have at least one UTI in our lifetime. But as you said, having recurrent UTIs is super frustrating and can be very, very difficult to navigate. And it's something I see in my clinic quite often.
And Rachel, as someone who does get recurrent UTIs, like you had mentioned, it's important to know when it is important to seek medical advice because, sometimes it's nothing to worry about, but other times it can become something that we need to take more seriously and can get worse quite a bit more quickly. So thanks for asking that question.
Definitely. So why don't we dive in, Shaz, with some of the basics, like what is a UTI and go from there. So a UTI or a urinary tract infection happens when bacteria, usually E. coli from the gut, gets into the urethra, which is a tube that leads from the bladder out to the outside world. And the E. coli start to multiply. And the classic symptoms that people often have are things like burning when you pee, having to go really frequently, feeling urgency, like you really have to go. Even if you've just peed, you still feel like you have to go. And sometimes you'll also get things like cloudy, smelly, or blood in your urine as well.
Thanks for sharing that, Sheila. And I think it's important not only for people to recognize the symptoms, but also to understand that there are some myths associated with UTI. So I want to start by busting one right off the bat. And that's that people need antibiotics all the time for UTIs. That is not always the case. A lot of times just hydration and monitoring your symptoms will improve the UTI on its own. But it's important to also know that if the symptoms are persisting, that's when you should get help. Because if you don't get antibiotics in those situations, that's when we can get into some serious complications.
That's a really important point. I appreciate that. And some people say, I had symptoms and then they kind of went away when I hydrated well. So there are options available that you can do at home before you even see us. People also often ask about, should I pee after sex? Does this help reduce the risk of infections? There's not a lot of great data that supports this, but it seems to be helpful for folks who do get recurrent UTIs or bladder infections after intercourse or sexual contact. So in that situation, it may be helpful, but for anybody else, it doesn't really seem to have very robust or enough evidence to say that we should all be peeing after sex.
What
A lot
about
of people-
cranberry juice?
Yes, this is the other one. So a lot of people ask about cranberry juice for treatment of UTIs. There's some evidence for cranberry extract specifically, but in terms of juice, it's often people are having like the sugary juice. That doesn't seem to really help. Cranberry extract specifically seems to help for people who get these recurrent UTIs, meaning 2 or more UTIs in 6 months or 3 or more in a year. What do you see in the eMERGE?
Yeah, and it's interesting that you bring this up because this is like such a common natural supplement that people ask me about. And often when people come in to the emergency department with UTI symptoms, they actually offer to me the information that they tried cranberry juice at home, they didn't get better, and then now they're coming in to seek medical treatment for their UTI symptoms. And in terms of the data, it is pretty mixed, but from my perspective, there's little harm aside from the sugary part of it. And so if you don't have any sort of underlying condition like diabetes where you should not really be taking in a lot of sugar, you can drink 1 to 2 8-ounce glasses of cranberry juice every day, or probably a simpler way, but sometimes a more expensive way to do it would be to take cranberry concentrate tablets. So anywhere between 500 milligrams and 1,000 milligrams as a total daily dose.
That's great. Thank you for clarifying that, because I think extract is really the key that you want to get. And so those pills can make it easier instead of taking in like a sugary drink. But that's super helpful. A lot of folks also ask me about how does menopause actually affect UTI risk? And they wonder, like, is it a myth or is it true that after menopause happens, do we get more UTIs? And the truth is, it's actually a fact that when you go into menopause, your body has less estrogen, and estrogen feeds the tissues of the vagina, the urethra, the bladder, the pelvic floor, and estrogen also affects the vaginal microbiome. So we have a conversion over to more E. coli, which is the common culprit in UTIs in postmenopause. And this whole complex of symptoms is generally referred to as the genital urinary syndrome of menopause. And certainly it can cause symptoms of vaginal irritation and dryness and pain, but it also can cause or be related to an increased risk of recurrent bladder infections. And so I have patients in their 60s, 70s, 80s who come in, they are getting antibiotics regularly. You probably see this as well, Shaz, for bladder infections. They're frequently on antibiotics. But the truth is, if we actually treat the menopause symptoms, the genital urinary syndrome of menopause, with local vaginal estrogen therapy, you treat the tissues, you're treating the vaginal microbiome, and it actually reduces the risk of infections, and people can reduce the use of antibiotics as a result.
Yeah, and I think that's a really important point, because when you talk about the vaginal microbiome, people often forget that just the same way as the gut, there are natural bacteria that live in the vagina, and that helps keep a normal pH. It helps kind of keep a balance of the equilibrium of the vagina, and prevents things like yeast infections, prevents things like UTIs. And when there is a disruption of that from things like not only menopause and a change in estrogen and the change in the pH, but also from antibiotics. Remember that antibiotics are helpful to get rid of the bad bacteria that you want to target, but they also can target the good bacteria, not only in the gut, but in the vagina as well, and then can increase risks of things like yeast infections or even more UTIs. So it's important to definitely talk to your family doctor if you are getting recurrent UTIs, because there could be other things and other ways to approach it, like vaginal estrogen, like you talked about. So, we are talking about UTIs, but the complications of UTIs are also really important. So can you tell us more about something called pyelonephritis?
Yeah, so pyelonephritis is a fancy word for a kidney infection. And if a UTI is not treated, or if bacteria travel up to the kidneys through the ureter, so the 2 tubes that connect the bladder to the kidneys, it can be something called pyelonephritis, or a kidney infection. And this is where things can get quite a bit more serious. And I see this in my office, but certainly, Shaz, I know you probably see this as well, often in the emergency room. And the symptoms that can happen for folks who, when they develop kidney infections, are things like a high fever, they can get chills. They can be quite sick. They can get back pain, or what we call flank pain. They can also get nausea or vomiting because they're quite sick. And Shaz, you see this more often than I do, I think, probably.
Yeah, and so typically what I see in the ER, because it's important to kind of delineate that UTIs, so just simple UTIs, these can be managed as an outpatient, by your family doctor at a walk-in clinic. But pyelonephritis is something that does actually require emergency care. So when the infection travels travels up to the kidney, this can then put the patient at risk of getting quite sick. And then that infection could potentially spread into the blood, which we're going to talk about as well. And so the reason that we treat this quite aggressively is to prevent that spread from happening. And so the usual way that we approach the treatment of pyelonephritis is to give a dose of IV antibiotics first to kind of get a big dose into the bloodstream and start kind of targeting that kidney infection quickly. And then we discharge patients after a bit of monitoring on a longer course of oral or pill antibiotics as well, because it does often take a bit longer to get into that kidney and treat that infection beyond just, typically for a UTI, it's 3 to 5 days of antibiotics. Right. When we look at pyelonephritis, it's an IV dose and then another 10 days of antibiotics by pill form as well. And so this is something that needs to come into the ER and is often taken quite seriously.
Occasionally, I'll have patients who have a history of pyelonephritis or kidney infections, and they'll know the early signs. Mm-hmm. And if we can get on top of it really quickly, we do manage it in an outpatient setting, but we have a really low threshold to say if you get worse, quickly, if you're getting the fever, chills, or worsening of your symptoms, it's really important to be seen in the emerge, like you're saying, Shaz. So I really appreciate that. This is where we really actually work together really well as family docs and emerge docs, I think, in that managing these sorts of things. I think one of the other things, so you mentioned urosepsis. So what happens beyond, what happens if this infection gets worse? And again, this is something that you see more often than I do. Can you tell us about urosepsis?
For sure. And so urosepsis is more likely to occur from an untreated kidney infection, but it can also occur, especially in patients with diabetes or elderly patients, just from a simple UTI or a bladder infection, because there can be some weakening of the immune system in those situations. And so what happens is the bacteria that you talked about, E. coli being the most common one that cause the UTI and infect that bladder wall, they can actually spread into the bloodstream. And so whenever bacteria does not belong in the blood. And so when there is a bacterial infection in the bloodstream, that can make people really, really sick. It can cause a high fever or sometimes a low body temperature as well. It can cause patients to have a rapid heart rate, feel really unwell. They can have some confusion, lightheadedness, and even really low blood pressure. And so this is something that can really spiral and deteriorate quite quickly and does require quite rapid intervention. And so getting IV antibiotics in these patients right away, and then getting fluids in them so that they're improving their blood pressure and starting to, feel better and get those symptoms managed. Because in things like sepsis, what we always talk about is the time to get those antibiotics in really has an impact on survival rates and how well the outcomes are. And so this is something that can become quite serious and is a serious complications of UTIs and pyelonephritis, and an important thing to keep in mind for sure.
Thanks so much for that. That's super important. And it's interesting to see people can deteriorate quite quickly. So it's important to get that help quickly as well. So I want to get back to Rachel's question, because she asked about why do some people get UTIs over and over again. And I know in my own practice, I have patients who deal with this quite often, and it can be super frustrating and difficult to navigate. So first off, it's understanding some key risk factors. So the key risk factors for recurrent UTIs or bladder infections that happen over and over again are things like sexual activity. So bacteria can get pushed into the urethra from sexual activity. And this is where we can see people get recurrent UTIs, which is where there's actually an option available to you. If you're someone who specifically gets UTIs after having sex or intimacy, then I can actually give you a prescription for 1 dose of antibiotic to take after intercourse, and that will help reduce the risk of it progressing to a full-blown UTI. Knowing that as a risk factor is important. And this is why it's important to know these risk factors, because then we can actually treat appropriately and be ready and prevent these things from happening. The other risk factors that increase the risk of UTIs are things like menopause. We mentioned that as well, and perimenopause as well. And I want to throw it back to our previous episode that we had on perimenopause, episode 2, I believe, Shaz, where we talked about perimenopause. Because of the estrogen losses that can happen and changes in the vaginal microbiome and also the tissues of the vagina and the bladder and the urethra, that can be a risk factor as well. Situations where you might have incomplete bladder emptying. So conditions like in diabetes, sometimes we don't empty our bladders because the neural pathways might not be firing in the same ways. And also nerve issues that can also affect our body's ability to know I have to empty my bladder. So if you're sitting with a full bladder or partially full bladder, that can increase the risk of UTIs or recurrent UTIs. And certain types of birth control like spermicides and diaphragms can also increase the risk, similarly due to the pushing of the bacteria into the urethra. So these are some of the key risk factors. And we mentioned diabetes as well before, and that's why it's really important to talk about diabetes as well.
Yeah. And, I think another important thing to keep in mind, certainly from an emerge standpoint and definitely from a primary care standpoint as well, is there are some things that can mimic urinary tract infections. So that includes things like sexually transmitted infections, but also non-sexually transmitted infections like yeast infections or bacterial vaginosis. And so if you have a new sexual partner, if you have kind of symptoms in addition to the ones that Sheila mentioned earlier, like vaginal discharge in particular, it's important to let your doctor know about that because it may mean that you need testing for these and the management is different than a UTI.
That's so important. Thank you for including that. Often if people have recurrent UTIs, they'll keep coming back and back. And sometimes it's because we actually haven't tested them for STI. So that's such an important point that we're treating as a UTI, but it's actually an STI. And it's not a shame or stigma thing. STIs are common. These are things that we just need to be able to treat. And so when we're asking you if this is something that may be a risk factor for you, there's a reason behind that because we can treat and get to the bottom of what's happening for you as well.
Exactly.
And so one of the things that we want to also address, which is also an area that can be difficult to discuss, but really common, is incontinence. And this ties into bladder health as well. So incontinence is when you involuntarily leak urine. And this affects up to 1 in 3 women and 1 in 9 men. And yet, despite being very common, it's something that we don't really talk about. And it's often, again, sort of like a silent hidden disease because people are not sharing about it because they're embarrassed.
Yeah, I really don't think we talk about it enough. And it's interesting because it's also important to recognize that there are some unintended consequences or unintended potential, injuries or issues that people can get because of incontinence. And I'll give you an example of something that I often see in the ER. And so as women in particular, as they age, their pelvic floor can weaken. You've talked about this in the context of menopause as well. And it often means that they have to get up in the middle of the night to go pee a lot more often. And what I end up seeing as a consequence of that is that when women get up in the middle of the night to go to the bathroom, sometimes they get up too fast and they pass out and have a fall. They trip on something or they're rushing to get to the bathroom and they have a fall. And then they end up having a broken hip or a broken bone or a head injury because they are getting up in the middle of the night to go to the bathroom due to their incontinence. And so this certainly hasn't, it's often thought of as a primary care issue, but it absolutely has emerge implications as well.
Wow, that's incredible, right? To think about it in that way, that it has that impact potentially on folks. And I certainly see it in primary care where patients don't leave their homes sometimes because they want to be near a bathroom and they worry about that. And that really has a huge impact on people's mental health as well. And again, there are things that we can do. Now, first off, what I always do with my patients is figure out what kind of incontinence it is that they may be experiencing because there are different types. So there is stress incontinence, something that we've felt before. It's leaks when you laugh or cough or exercise, when there's increased pressure in your abdomen, pushes down on the bladder, and you can actually leak urine with a cough or like a laughter. It's quite common after childbirth. We also see it after menopause as well. There's also then the second type of incontinence called urge incontinence. It's sort of that really urgent, I gotta go now kind of feeling. And you have a sudden leak, like you basically don't have time to make it to the bathroom in time because it's your bladder contracts really quickly, and it can cause that symptom that you leak a little bit. And then there's overflow incontinence, which is sort of a constant dribbling when the bladder doesn't empty fully. And sometimes people have a mix of all of these different types of incontinence in one, where they have stress, a bit of urge, and that can be challenging to differentiate. But there are treatments available for each of these different types.
Yeah. And, as I said, from an ER perspective, not only can these symptoms of incontinence lead to falls, they can actually lead to UTIs and then skin infections from briefs that people are wearing for prolonged periods of time, especially in older adults. And then, of course, this absolutely takes a toll mentally. Many people, as you mentioned, withdraw from social activities, stay at home because they don't want to be away from a bathroom and because they feel embarrassed about it.
And, I think there's a lot of fear around talking about our hope in doing this discussion is that for UTIs and for incontinence, there are treatments available. There is help available for you. It is a matter of talking about it, bringing it forward to your own clinician, your doctor, your nurse practitioner, because there are really good treatments. When it comes to incontinence in particular, we're talking about things depending on the type of incontinence, but pelvic floor physiotherapy can be helpful. My pelvic floor physio colleagues are amazing. They really know the pelvic floor intimately and are able to really help folks in understanding their own anatomy and helping them with incontinence. There are also medications that we can use that I can prescribe for my patients depending on the type of incontinence that are very helpful to help them get through the night, to get through events, to get them out of the house when they're feeling nervous to leave the home. And there's also certainly bladder training that we can do. And in some cases, we also can do things like surgery in significant cases, especially if something like prolapse is happening of an organ like a bladder or uterus is pushing on the bladder, then we can certainly do that as well with a referral to our specialist colleagues.
Thanks so much for that, Sheila. Now, as we kind of wrap up this episode, can you first start by giving us a quick recap on when people should see a doctor?
Sure. I think any of us who have had a UTI know how uncomfortable it can be. So please do see your doctor if you have symptoms like UTI symptoms, especially if they're lasting more than a few days. Get help, because this is something that can progress, as Shaz had mentioned, what she sees in the emerge, things like pyelonephritis. We want to get help if you're having significant symptoms. If you have fever or back pain, again, this could be a sign of a kidney infection. You really want to get help quickly to prevent that spread and further spread and pain and other issues that can happen from a kidney infection that goes unchecked. Also, symptoms of sepsis. So we touched upon sepsis. So if you have shaking, chills, confusion, low blood pressure, you may not be experiencing this, but if you notice that your family member or loved one, often we care for loved ones who are maybe older and they're experiencing things, that might be a kidney infection or a bladder infection that's gone unchecked and causing something like sepsis. And also, finally, I want to suggest, like, if you're having incontinence of any sort and it's affecting your daily life, please do seek out support. We have supports available for you. You don't have to suffer through this.
Thanks so much for that, Sheila. And as we always end every episode, here is our Doc Talk prescription for bladder health. So number 1, stay hydrated. It is the easiest way to flush out bacteria from that urinary tract and often can actually treat mild UTIs without needing antibiotics. Of course, number 2, please don't ignore early symptoms. When it comes to a UTI in particular, if that hydration is not improving your symptoms, it's important to see a doctor before things get more serious because you likely will need antibiotics. Number 3, know your risk factors. So if you do get recurrent UTIs or have incontinence, please talk to your doctor. There are different options in terms of what can be done to help mitigate these things. In particular, it is important to talk to your doctor about treating genitourinary syndrome of menopause with local vaginal estrogen, because of like what we talked about in terms of having chronic antibiotics can alter that vaginal microbiome. And lastly, as you mentioned, pelvic floor physiotherapy is a game changer. It is so effective at helping strengthen that pelvic floor, but is often underused.
And remember, bladder health is a real medical issue, and you're not alone, and there is help out there.
So that's a wrap on today's episode of the Doc Talk podcast. If this episode resonated with you, please share it with a friend or someone who keeps just holding it in when they should be getting help.
And if you have any questions for us, please do continue to send them our way. We love hearing from you and sharing, because everybody else has the same questions that you do. So until next time, please take care of yourselves and your bladder.
Thank you, everyone, for tuning into today's episode of the Doc Talk. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs. Please be sure to follow us on social media at the Doc Talk Pod and send us your questions.
This episode is brought to you by Always Discreet. Our patients often share that if they sneeze or laugh too hard, or even during a workout, there can be bladder leakage. There's no shame in this, and there are solutions. You're not alone, and there's no need to worry. Always Discreet is here for you. Many experience urinary incontinence as they go through perimenopause and menopause. Nearly half of us may encounter leaks or accidents during this time. And by age 65, about 75% of women report experiencing some form of urinary leakage. Yet it's a topic that we rarely discuss.
Always Discreet's Rapid Dry Core locks away even the biggest leaks with no wetness, odor, and no visible lines, allowing you to stay active and confident. They stay in place comfortably and remain invisible under clothing. Check the link in the description for an Always Discreet coupon and step confidently into this new chapter. Always Discreet, your dependable solution for bladder leaks.